If you've recently thrown your back out, then you know just how painful it can be. And you probably want to learn what you can do to get out of pain fast. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain what it means to throw out your back, how you can relieve the pain quickly, and what you can do to keep from throwing out your back again in the future. So first of all, just what does it mean to throw out your back? It's a term that everyone's probably heard, but what does it mean from a medical, physical standpoint? And truly, there's no medical term of throwing out your back. It's kind of a colloquial term, but how it's used is usually a sudden injury. Oftentimes it's from lifting something or bending down and getting a sudden catch in your back where you know there was an incident. It didn't just come on gradually. You didn't wake up with one morning. You had an incident or an episode and you threw out your back. Now, most of the time, that doesn't mean that your back has gone out of place. It doesn't mean that you've slipped a disc. In fact, discs don't slip out of place. Slipping a disc isn't really a thing. It doesn't mean you've herniated a disc. Doesn't mean you've injured anything seriously, even though the pain is really, really bad when you throw out your back. Most of the time, the pain from throwing out your back is just from a really strong muscle spasm. And that happens because when you do repetitive motions like repetitive bending or repetitive lifting, you move typically through the same spinal segments. The ones that are most common are the L4, L5 segments and the L5, S1 segments, the two lowest ones down in your back there. And when you bend and move repetitively at those same segments over and over and over, you develop a little bit of excessive mobility or hypermobility at those segments. And what happens over time is those segments start to move and shift a little bit more. So when you bend forward to bend down to pick something up, or you bend forward to lift something, one of those segments kind of starts to shear a little bit on the other one. And when it gets a little bit too far, when it starts to shear outside of what your brain and your muscles know is normal, your back muscles spasm up or tighten up really to protect you. So when you've thrown out your back, a lot of times the pain that you feel is actually your back muscles protecting you from actually throwing your back out of place. So that spasm that you have is actually kind of a good thing, but it hurts and you want it to go away and keep it from spasming again in the future. So first of all, if you've just thrown out your back, you probably need some tips to learn how to get those spasms to stop and what you can do to just relieve the pain immediately. So a lot of times those spasms or the pain that you get is caused from muscle spasm. And so one of the best things you can do immediately is to get those muscles to calm down, as well as to stretch the muscles out. And one of the easiest ways to get the muscles to calm down, because their function is to support your spine and hold it upright with gravity, is just to lay down on your back where you're supported. Your spine isn't vertical with respect to gravity. Gravity's pushing down this way, and your spine's horizontal. So your back muscles don't have to work really hard in this position in order to support your spine. Now, having your knees bent kind of helps flatten your back out on the bed or on the couch or whatever you're laying on so that you don't have a lot of arch or curve in your back. It puts your muscles in a nice relaxed position. And then just taking some deep breaths, breathing in through your belly. This uses your diaphragm, and then breathe out. And when you breathe out, that actually kind of activates some of your stabilizing muscles in your abdominals. So there's a twofold effect. Breathing in relaxes your muscles. Breathing out kind of helps you activate your abdominal muscles, which helps support your spine and can help keep you from throwing out your back again in the future. So just doing your deep breathing. Belly rises as you breathe in. Belly falls as you breathe out, and your lower back should flatten into the bed as you breathe out. Now, after you've done that, spinal bending or spinal flexion exercises are a good way to stretch out your lower back muscles. One of the easiest ways to do it is on all fours if you are able to kneel, and just rocking back into a child's pose or prayer stretch and kind of resting back like that. Again, gravity is pushing down this way and you're rocking back this way. And so you don't have a lot of compression force on your spine. Now, as you start to recover and you start to have pain that is not quite so intense anymore, it is a good idea to relieve that fear in your brain of bending. And a good way to start out with doing that is just doing a bending in forward, where you're in that position that you got injured in if it was from a bending injury, but you're not weight bearing. You still kind of have the weight of your hands and you can lean on your legs. So you're going somewhat against gravity with this, but you're not using your entire back muscle to help hold you up. Now after that, as you get back into bending going forwards, if you bend like this, your back muscles have to work really, really hard to hold you up. And if you're doing a bending like this or lifting like this initially when you're injured, that's a good way to set your back up to go out, so to speak. So if you keep your center of gravity over your feet by pushing your hips backwards, that keeps you centered right over here. And your back muscles don't have to work really hard like this. Actually, most of the work is being done by your butt muscles or your hip muscles back here. And so as you get back to bending, pushing your hips back, allowing your back to kind of relax and bend, my back muscles really aren't too active here at all because my spine's going downwards. It's almost actually like a traction or a distraction of your spine, where once you get past that 90-degree bend, gravity is actually kind of helping to stretch you out. And if you can get down to here, this actually feels like a pretty good stretch for your back. But again, that's not the first line treatment that I would do immediately after you've thrown your back out, so to speak. So once you've gotten rid of the pain, how do you keep from throwing out your back in the future? Well, the bending tip that I just showed you of keeping things close to your body when you're lifting, not lifting from way out there, not bending really far forward, but getting close to something before you bend down to pick it up. Those are all really good tips to help prevent back pain from coming on in the future and to help prevent throwing your back out again. Now, beyond that, you do want to do some stabilization exercises or core strengthening exercises. And I think core strengthening is largely rather overrated. It's a buzzword that a lot of people throw around, but strengthening your abdominal muscles can help support your spine to help keep you from having that hypermobility where your back muscles have to spasm up to help prevent you from having your back go out in the future. And so there is another video that I've made about core strengthening exercises for your lower back. And I'll link to that below here so that you can check out some of those exercises and see which ones may be applicable to you. Now, if you have thrown your back out, there's also really good evidence that if you get into a physical therapist within the first 2 weeks after throwing your back out or having a severe back injury, particularly if you don't have pain that's going down your leg, if it's just localized lower back pain, there's a really good chance of getting better in as few as 1 to 2 visits. And so taking early action after you've had a back injury often will do better than taking a wait and see approach, then going in and getting medications, possibly having an x-ray, an MRI, which all adds to your medical costs down the road. So oftentimes seeing a physical therapist quick will help save you money down the road and get you feeling better faster. And if you happen to be in St. Louis and you do need some help for back pain, we'd be happy to help you out here at More for Life. And if you're watching this from somewhere else, I would recommend contacting someone near you to help you with your back injury. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.